Hello everyone and welcome back to Ananta Wealth Management. Today we are diving into a topic that's on a lot of people's minds, whether for ourselves as we age or for the loved ones we care for. It's something most of us would rather not think about, but it is one of the those things we absolutely need to plan for. This topic is about long-term care. You might be wondering why. I would say why not? Because if you look at the costs of the long term care, they can be astronomical. What could be the reason? Here we are talking about assisted living, nursing homes, and even in home care. These long term care expenses can drain your savings quicker than you might think, especially if you haven't planned ahead or have taken time to understand your options. So, in this episode, we are breaking down the ins and outs of the long term care and, more importantly, also explore a potential solution, which is long term care insurance. Now, let's be clear, this isn't about fear mongering, it's about being prepared. It's about having a plan in place so to ensure you are prepared for the growing expenses of long term care. We will cover different types of care, the typical costs involved, and how long term care insurance can help bridge that financial gap. By the end of this video, you will have a much clearer understanding of long term care and how to plan for it. So, you can make informed decisions for yourself and for your family. Alright, let's get into it. In the next slide, we will take a closer look at our growing US population. Have you ever wondered how many people are in the US right now? Or how fast we are growing? Well, let's get right into it. Let's go through the US population trends from 2020 to 2025. The US population has been steadily growing over the past few years. In 2020, we had around 331.4 million people approximately. By 2021, we added 1.5 million more, bringing us to 332.9 million approximately. In 2022, another 1.3 million, pushing us around to 334.2 million. Then things picked up in 2023. We saw approximately 2.3 million jump, hitting 336.5 million. Now, coming to 2024, 2024 kept up with the trend, adding another 2.1 million, landing us at approximately 338.6 million. And for 2025, the Census Bureau projects says that we will hit 340.1 million with a 1.5 million increase. So, while we are still growing, it's not at a constant rate. Some years are faster than others. Now, let's talk about the breakdown, men versus women. Who is leading the numbers? Looking closer at men, in 2020 we had 163 million men, and that number grew to 163.9 million by 2021 and 164.6 million in 2022. Then in 2023, we saw a bigger jump to 165.8 million and to 166.9 million in 2024. By 2025, it's projected to be around 167.7 million men in the United States as per the Census Bureau. Now, let's look into women's population. Here, 2020 started with 168.4 million women. Then the numbers rose to 169 million in 2021, 169.6 million in 2022. 2023 brought a bigger increase to 170.7 million, and we hit 171.8 million by 2024. 2025 is expected to be 172.4 million women in United States. So in case if you are wondering, yes, it is women slightly outnumbered men in the US. Now, what's the bigger picture here, and what does all these numbers mean? It means our population is still growing. We saw the biggest jump in 2023, but we need to wait and see the numbers in 2025 whether the growth rate is expected to continue or cool off. Women continue to outnumber men, but both groups are increasing at a steady pace. 2020 to 2023 numbers come from actual census estimates, while 2024 and 2025 are projections, meaning the numbers could change. All right, you might be thinking about why should you care about these numbers. Well, a growing population impacts everything like jobs, housing, healthcare, social security, and even traffic. More people means more demand for resources, and learning about these trends helps us plan for the future. As our population keeps growing and aging, one thing is clear: planning for the future is more important than ever. With more people living longer, the need for long term care is also rising. And let's be real here, care costs can add up fast. That's where planning ahead for long term care makes a difference. It helps safeguard our finances while making sure you get the support you need, whether it's in a nursing home or assisted living or even in the comfort of your own home. Now, what's the key takeaway here? Two words, that is plan ahead. Plan ahead. The earlier you look into the long term care options, the better prepared you will be, both financially and emotionally. Because when the time comes, you will want peace of mind knowing that you made the right call. And if you want more details like age group breakdowns or regional stats, check out the US Census Bureau reports. They have got all the data you could ever want. In the next slide, let's look briefly at the need for long term care, limitations of medical insurance, and costs associated with the long term care. All right, let's get to the point. Thanks to medical advances, people are living longer than ever. But with that comes new challenges. As we age, our bodies and minds don't always keep up, and many folks will eventually need some form of long term care. That could mean help at home, in assisted living, or even in a nursing home. Now, here is a jaw dropping fact. Experts say that if you turn 65 today, there is a 70% chance you will need some type of long term care at some point in your life. That's right, 7 out of 10 people. And guess what? Around 42% of people will receive paid care at home, while 37% of them will require care in a facility. Okay, let's talk about why this happens. Sometimes people need nursing home care for short term rehabilitation, maybe after a surgery or a hospital stay. Other times, long term stays are necessary, especially for those dealing with cognitive impairments like Alzheimer's or dementia. When a person can no longer manage daily activities like eating, bathing, or dressing, at that point, professional care becomes a must. Now, here is the kicker: long term care is very pricey. We are talking anywhere from $60,000 to over $160,000 per annum. Can you imagine that? And this depends on where you live. That's a serious hit to your savings, and unfortunately, medical insurance and Medicare don't cover most of these costs. Now, let's clear about a common misunderstanding on medical insurances. They say medical insurance might cover short-term stays in a skilled nursing home for rehab, but it has its own limitations when it comes to long-term care, and it might not cover. And how about Medicare? Does it cover? It only covers certain medical services, not custodial care like help with daily tasks or personal needs. So, finally, this is where having a game plan makes all the difference. Without preparation, long term care costs can drain your finances faster than you think. So, what's the key takeaway? Know the facts, explore your options, and make sure you have a plan in place for your future. In the next slide, we will look into types of care. Now, let's look at different types of care, starting with skilled nursing care, custodial care, hospice care, home health care, long term care, assisted living facility care, and adult daycare. First up, skilled nursing care. This is where the medical pros come in. Think licensed nurses, doctors, and therapists providing services that require their expertise. Basically, it is high level medical care when you really needed it. Then there is hospice care. This is for those facing a terminal illness. It's a team oriented approach, focusing on medical, physical, emotional, and spiritual needs. It's about providing comfort and support during a difficult time. Next, we have custodial care. This is about the day to day stuff. Imagine help with eating, bathing, dressing, those activities of daily living. It's non medical, but it is absolutely essential for comfort and dignity. Moving on to home health care. Now, this brings care right to your doorstep. Think nurses and therapists visiting your home. It's about receiving care in a familiar and comfortable setting, which, let's be honest here, it makes a world of difference. Next, we have long term care services as a whole. This encompasses both medical and non medical care for chronic illnesses and disabilities. It's about providing ongoing support to maintain quality of life. Basically, it's a safety net for those who need it. Now, assisted living facilities. These are residential communities that offer personalized care. Imagine help with medications, laundry, and housekeeping, all while maintaining some level of independence. It's about having support nearby when you need it. Finally, we have adult daycare services. These centers provide supervision and activities during the day. It's a great option for families where caregivers are working, and it offers a social and engaging environment for adults with impairments. Think of it as a daytime community. So, there you have it, a breakdown of the different types of long term care. Well, understanding these options is crucial for planning ahead. Remember, it's about making informed decisions for yourself and your loved ones. Next, we will look into different ways to pay for long term care. First up, let's talk about where long term care happens. Well, you have got several options here, like home, community centers, residential facilities like assisted living, and institutional settings like nursing homes, and more. It's all about finding the right fit for you. Now, here is the thing, the cost of long term care can be a real roller coaster. Many folks have short stays, usually, or sometimes family pitches in, um, so it's not always a huge financial burden. However, for those who need extended care, it can be astronomical. Basically, it varies wildly from one person to another person. Alright, now let's talk about who pays for it. There are basically four main ways to pay for your long term care expenses. They are Medicare, Medicaid, your savings, and long term care insurance. Now, let's break each one down. First, Medicare. It's a common misconception that Medicare covers long term care. Actually, it generally doesn't, but it will help with short stays in skilled nursing, hospice, or home health if and only if you meet some strict conditions. Think a recent hospital stay, admission to a certified facility within 30 days, and needing all that skilled care. Even then, it is limited to 100 days. Next is Medicaid. This is a federal and state program for low income folks. But here is the catch, each state sets its own rules. So, eligibility, services, and payments vary a lot. Medicaid does cover a huge range of services from hospital stays to nursing facilities and even home care. Now, regarding Medicaid eligibility, you must meet certain general and financial requirements. Generally, you must be 65 or older, or disabled, or blind, or pregnant, or a parent or caretaker. And there are some asset limits. In 2022, the equity limit was around $636,000. So there are rules to follow here. Okay, let's talk about Medicaid planning. States have a look back period which is 60 months to see if you have transferred any assets to qualify. If you gave away assets for less than their fair market value, you will face penalties and delays. Basically, they want to make sure you're not just giving away your money or assets to qualify for Medicaid. So, there you have it, a breakdown of long term care and how to pay for it. Well, it's a lot to digest, right? But it's crucial to be informed. Again, remember, planning ahead is key. Alright, that wraps it up for today. Thanks for tuning in. If you think you got value out of this video, please consider hitting that like button and subscribe for more useful content on financial planning.